Welcome to Beyond Bones and Muscles, a Legent Health podcast. Created by the team at Legent Health, a healthcare system devoted to helping you live life to the fullest. Your health, our priority. Each episode, Chief Operating Officer Daniel Brazell keeps your finger on the Legent pulse, going beyond the bones and muscles of Legent Health. We will discuss orthopedic and spine industry education and analysis, along with news from around the Legent healthcare system.
Good afternoon, everyone. It's Daniel Brazell again here with our podcast, Beyond Bones and Muscles, here at Legent Health. Very excited about today's podcast. We're kind of kickstarting these podcasts off again in 2025. We had a session last week. We've got a new one today with some of our facility leaders, and excited to have this conversation with our peers about, our facilities, some of the tailwinds and headwinds they're seeing within both their facilities and sort of at a macro level within the industry, and really just have a conversation about, how we as facility leaders can continue to optimize our facilities, help our physician partners, help our staff, and ultimately drive quality and financial performance at each one of our locations. So with me here in the studio, I've got Cole Schmitz, who's our CEO of Carrolton and Plano Hospital. Excited to have him with us. Dialing in remotely, we've got Virginia Snyder, who's our administrator and director of nursing for our facility in Florida, Delray Beach Surgical Suites. And then also dialing in remotely, we've got Kathryn Katie, is what she goes by, who's our CEO of our Tomball, North Houston facility, which is one of our surgical hospitals, along with Cole, who also is running Plano and Carrolton Hospital, which are surgical hospitals, and then Delray Beach is one of our higher acuity surgery centers within our portfolio. So welcome, guys. Glad to have you with us.
Glad to be here.
All right, excellent. Okay, so again, as I mentioned at the onset, and Cole, I'm going to start with you with this first question. We want to have a conversation today about really, as facility leaders, you're managing a lot. You're managing people, you're managing performance, both clinically and financially. You're managing dynamic physician relationships with our physician partners. So with all that being said, Cole, I'm going to have the same question for you, Virginia and Katie. What keeps you up at night? What are you worried about?
Well, obviously, patients come number one. I think, if you have a patient-centric attitude and you approach everything that it revolves around patient care, you're covered as a leader. Financials, obviously, all of that keeps me up to make sure that the performance of the facility meets budget. Obviously, meeting budget, all that's important. But the main focus for myself and my team is to make sure that all of our patient care is covered. That, from a service line perspective, from a surgical perspective, all the way from pre-op calls, all the way to the follow-up call, just to make sure that is on point. All the other stuff, it is important, but not as important as that. So I would say with all the moving parts that we have going on at the facilities, those are the things that I focus on the most.
Excellent. I'm going to come back to that because you do have quite a bit going on within the different service offerings at your facility, so I could see why that would definitely keep you up Absolutely. At night. Virginia, how about you? When you think about your facility and you have a very busy, high acuity surgery center, what's keeping you up at night as well?
So probably not the answer that you are expecting me to say, but I really don't feel like I am kept up at night. And I think that that's because we're really working towards being a well-oiled machine. We are 2 OR facilities, so we kind of have that luxury, but I've been working very closely with the entire team and, making sure that we have our daily huddles and that we're improving communication. And so I feel really confident that we're always providing, the safest patient care possibly. I feel like we are always staying on top of our tasks and addressing financial things. So I feel really confident in the work that we're doing, and I'm not really kept up at night. But however, I will say, I am always on my mind thinking, how can we do better? How can I myself do better? How can my team do better? How can we always do better? So that's often a thought that's in my mind.
All right. Well, good. I guess you're getting a good night's sleep. That makes one of us. Yeah. So that's good. That's awesome. Katie, same question for you. You're running a physician-owned or physician-partnered hospital. You've got, a ton of partners, both that are practice-related and also are partners in your facility. So you have a little bit more of a nuanced relationship with your physicians. But what's keeping you up at night as well?
There's a lot that keeps me up at night. So the biggest one is patient care, that's kind of always at the forefront, I think. And for us, the biggest one for me is our reputation in the community. That keeps me up at night. I want to make sure that we are competing with a lot of big dogs here right around us. And so those other systems, the patients can go anywhere, right? And I want them to come to Legent. I want them to refer their friends to Legent. And I want them to love the experience they have here. So that's a big one for me. The other piece is, how are we going to stay cutting edge? How are we going to continue to grow? That keeps me up. Growth is a big one for me. I know that we want to continue growing. I know that everyone around us is growing. And so growth and what the next thing is a big one for me, for what keeps me up at night.
Yeah, that's awesome. I really appreciate that. And that kind of segues into, Katie, I'm going to start with you and then pivot back through the group. You talked about a lot of different things going on at the facility, and I think Cole and Virginia are going to have a similar response. But why don't you highlight some of the developments that you're seeing? Because we're coming out of the gates very strong in 2025. 2024, as we all know, was more of a transformative year for the organization, setting us up for really consistency and a platform for growth. But talk about your facility and some of the new developments that you've got going on, and really some of the positives that are going on at your Tomball facility.
Sure. So this year we opened a new unit in our inpatient department. It is our medical management unit. We've started a inpatient detox unit here on our campus. That was slow, but it's really starting to take off. We're having patients that are detoxing with us. They have been phenomenal patients. We partnered with another leader in kind of the up and coming market here in the Houston area, Psych Plus for that. And then we've branched out into pulmonology. We're doing a Zephyr valve procedures, which is kind of a breakthrough in COPD treatment. It allows the patients to really get their life back, get off of oxygen, really have a better entire work-life balance. Some of them go back to work after these procedures. It's been really remarkable seeing our first patient and now our second patient come through, and just the change from pre-op to post-op where they can breathe again. They don't need post-operative oxygenation. It's really world class. So that's been a huge thing for us this year. We are doing huge spine cases. Our inpatient unit this month has been full. So we're at bed capacity. And so we are just growing and kind of looking for, do we open up more beds? What is that going to look like? How do we kind of respond to the really exponential growth that we've had just in the last 60 to 90 days of this year?
Yeah, that's great. Really exciting to see Tomball performing at the level that it's performing, and the investment that you and the physicians have made in regards to equipment, state-of-the-art equipment, really attracting a lot of great talent, physician talent in the community to come and operate at our facility and provide great patient care. So really exciting to see that develop, and obviously with your census increasing, there's a lot of positives going on here for the future. So thank you, Katie.
Yeah.
Virginia, same question for you. You've got a bright future, but also your present is very exciting as well. Talk about some of the positives, both from a cultural and a people and also a physician and specialty perspective. Really, tell us what's going on at your facility.
Sure. So as far as like with the physician and the actual facility at Delray Beach Surgical Suites, we this year I feel like we've taken on a little bit more acuity. We're definitely increased the number of total joints that we're doing instead of maybe some of the smaller cases. We actually performed towards the end of last year our first A-lift procedure, and that's something that we've been discussing putting another procedure on. We're filling every inch of the block time that we possibly can. We're actually looking to recruit 3 new physicians right now to our center that will then be interested in what is in the works for the future. We are building a new 6 OR ASC, which we're very excited in the beginning stages of. We're working on the floor plan currently and, again, physician recruitment. So kind of working out like a deck and a plan for that. And then as far as like employee morale, I think communication is just key. Like we're always communicating with our team, and we make sure we always have our monthly meeting. At those monthly meetings, we ensure that we're doing a kudos and highlighting something that happened within that month an employee did right. We're also getting ready we're a little bit behind, but we're getting ready to celebrate Employee Appreciation Week. We scheduled that so that we could schedule appropriately with the most amount of full-time employees there. And we have some fun stuff in plan for them, like a little spa day and a carnival day. So it's going to be a great time to really recognize the employees and their hard work, because they really do give it their all. We've recently had a turnover time that was a little longer than we typically have. And we discussed that with the team, and they worked really hard. And our goal ultimately is 10 minutes, but they've already got the turnover time down to 12 minutes. And I have no doubt that we'll be able to reach that 10-minute goal.
Yeah, great progress there. Yeah, you and taking the helm of the facility over the last couple of years has really just been transformative to the culture and the physician alignment that you've really established through your leadership. So thank you. And I'll tell you, that new facility that we're working on is a game changer for the market. So super excited about getting that launched. We got all the physicians really dialed in on the project, and under your leadership, I think we're really going to be successful there. So thank you. All right, Mr. Cole, where do I start?
I'm about to say, how much time?
How much time do we have to talk about your facilities, and what you've got going on? So get us up to speed, man.
Well, I'll start by piggybacking off of what Virginia said. I mean, it goes back to the team. Over the past year, I mean, we've asked them to do what most organizations, it takes 5 to 6 years to do, and we've done it successfully, safely. So, as far as my team goes, I can't speak enough about how they've performed and how they continue to perform under high stress, high volume, not only keeping up with the patient volume that we've had historically, which was our bread and butter, spine and ortho. We've branched out into other service lines, ENT, cranial-based ENT, which is not, just tonsils. So, we've gotten into a lot of cranial-based ENT. And then specifically for Carrolton, a ton going on at Carrolton. I mean, I could spend 3 podcasts talking about, what all's going on at Carrolton.
Here's the treetops, though. There are some really exciting things.
There are some treetops. So, happy to say we're doing our second vascular case today. Patient just got out of the OR, successfully done. We onboarded that service line with a new physician group that, it goes back to really the investment that these physicians that we have partnered with give to the facility. Yeah. I mean, without staff and without the team and without the physicians' guidance, these initiatives are hard to push forward. So I can't speak enough kudos to the team for pushing that along. Along with the vascular program, we've started our ICU unit at Carrolton. So we're really focusing on the acuity of patients that we can care for in our community. So that has been an undertaking. The team and the onboarding of some of the new employees that we've had have been instrumental in that. So we've also, we're partnering with a company to bring on inpatient rehab into Carrolton, which is, not typically our bread and butter, fundamentally, spine, ortho, musculoskeletal, those things. But now we're really trying to focus on encompassing the holistic approach to patient care to make sure that we are, a one-stop shop, easy button for the physicians and the patients to make sure that they have a smooth throughput from, hey, you've been diagnosed with this is what this looks like, this is where we're going to send you, they can do X, Y, Z. So I feel like with that inpatient rehab unit, we'll be able to really encompass and focus on the holistic approach for the patients, which is great. Yeah. We are expanding our ORs. We have an internal build going on at Carrolton to where we're going to have 7 additional ORs and 2 cath labs. So
let's kind of pause and say that again. Where are you currently at, and where are you going to be within 12 to 15 months?
12 to 15 months. Hopefully that build will be off the ground in 12 to 15 months. Yeah. Realistically, we are just hyper-focused on the initiatives at hand, which are bringing on vascular, bringing on the inpatient rehab, and bringing on ICU to where we can capture those cases that we need to.
Yeah, just so the audience realizes the scope of this, we currently have 3 operating rooms at Carrolton. We're adding an additional 7 within two suites to handle cardiovascular and some other minor procedures that can be done in those two rooms. So that project in and of itself is a monster, and it's going to take a lot of time, a lot of capital, a lot of focus, and not distract us from sort of the core that you talked about as far as expanding service lines too. So it's a massive project. So guys, when you think about everything you have going on, most of this is possible because of the dynamic physician partnerships that we've developed and the relationships that we're fostering with our physician partners. So Katie, I'm just going to ask you, and then we'll ask some other questions to the leaders. How have you managed the dynamics of the physician partners that you're aligned with at your facility? Because it's a bit of a different machine when you have physicians who are, true equity partners with you rather than just physicians that are on your medical staff that are coming in and out and maybe going to a lot of other facilities. So how do you manage that dynamic and manage it successfully?
It's a lot of communication, a lot of open communication. All of the physicians have a voice. We talk daily, weekly, monthly. The team on our campus plays a huge center stage to that because a lot of our physicians have known and worked with or around a lot of our staff. And so there's a lot of professional relationships of trust and growth and development there. And our team is phenomenal, all of them across the board, from inpatient to my admin team to OR and perioperative services. They all also have a very close rapport, and they feel and have the autonomy to have those conversations with the physicians. And so when I talk to the physicians, they kind of know what the kind of temperature is on the units and what's going on. So everybody is able to have a very open communication here, which really helps with kind of trying new things or making sure that everybody's held accountable because we all communicate openly. It's not a closed door. It's not the physicians don't talk to staff, or there's this kind of elitist thing that's typical with staff to physician relationships. Everybody here has a voice and it's respected. And even if it's, turned down or that's not a good idea, we still respect one another's ideas.
So again, team, as we talked about all the different projects that you're managing, the successes of your facilities, different service lines, your physician relationships, et cetera, it's a lot to manage, right? Daily, weekly, monthly, et cetera. So Virginia, what tools do you leverage to be successful in monitoring the performance of your facility, both clinically, operationally, financially, both at the local level and then at the corporate level? What tools are you leveraging to really stay on top of your facility?
So I would say, the number one thing is ensuring that I'm prioritizing things because I wear 2 hats. I'm the administrator and the director of nursing. And so I need to be concerned with both the business, the financials, and then also the clinical, patients and the nursing care that we're providing. And so, I don't do it alone. I do it with a team. And I am fortunate to have someone stationed in each department. And to some extent, my entire team is somewhat newer leaders. They've been doing it for a year, maybe 2 years. But I've only had the opportunity to work with them over the past couple of years that I've been at the facility. And so I do spend a lot of my time investing in my team and their growth, helping to teach them the financial side if they're a clinical leader, just investing in their overall growth altogether. In services and audits are number one go-to ensure that on a quality standpoint that we are doing everything that we're supposed to be doing to ensure safety. And I mean, that's really the key is the leadership team, educating your nurses and ensuring that you're giving safe care to the patients. And I don't do this alone either. I've reached out to my corporate team for help, and they're always available, no matter how busy everyone is. They pick up a call, they put a meeting on the schedule, and they're there to assist, and I really appreciate that.
All right, that's excellent. Really love to hear that collaboration. Cole, same question for you. Again, tons of projects. You're managing a lot of patients in and out, a lot of physician relationships. What's your go-to in regards to the tools that you are leveraging to be successful in really driving a high-performing facility?
Well, obviously, data is important. The only hindrance to, some of the data is, a lot of data that you receive is a little retroactive. So like Virginia was pinpointing, I think proactive communication with the docs, making sure that, they feel empowered to reach out to not only yourself as a leader, but the leaders below you as well to accomplish the things that they need to, make their patient care the best that it can be. And I think, obviously all the people that we interact with on the daily, whether it be AP, IT, the analysts, they all play a huge part in getting us the data we need to ensure that the health of the facility is where it needs to be. For myself, I think, just keeping open dialogues with the physicians, monitoring KPIs, your key performance indicators for your facility to ensure that, your patient care is where it needs to be. Just making sure that, Press-Ganey scores are returned, making sure that, you're hitting your benchmarks and that you are, like Virginia said earlier, you are, and Katie said that you are competing with the big box systems in the community, which is it's not an easy undertaking. So I think, all those things align, and I think a proactive approach is always the best. Retro data is important, but I think proactive communication, making sure that your physician and your staff are engaged in your projects, go a mile.
Yeah, I agree. And I've seen all three of you really focusing in a lot more on the proactive side of the business, not just the retro. Because again, to your point, you can't really do anything about the past, but you do have the ability to impact what's going on at your facilities in the immediate and in the near-term future as well, with making minor tweaks both to the care delivery and then also the operational side of the business. So that's great. Same for you, Katie. What are some of the tools that you're leaning on to be successful as a hospital CEO?
So I'll kind of piggyback off of Virginia as well. So I'm the CEO, CNO, and the director for both my inpatient and my perioperative services here. So it's a lot. It's a big oversight. And for me, it is a lot of really open communication. And I have a lot of networking that I've done internally inside of our Legent Health, corporate. So I get daily updates for what our reimbursements are. What does AP look like? What is AR looking like? I have daily meetings with my teams about our KPIs. Why are we late? What's going on? What are our FCOTs sitting at? What's turnover time? How fast are we getting pain meds? When are we reassessing? I have process improvement projects that we implement biannually, and then we follow those and see how are they working, how are they not. Our quality and infection prevention coordinator, Lindsay Wyvell, has been a huge asset to our team since we hired her mid-year last year. And then I have an amazing pharmacist that's really, really good with our antibiotic stewardship and our narcotics watches and reporting out. And networking and my team and our open dialogue. I have a very open door policy. They know if they text me with a 911 siren, I will come no matter where it is or what time. It does not matter. I will hang up a call and I will go, because that is the most important thing is my team valued and do they trust me? And that is a key for everything that we do here. We have a phenomenal team here and they work their butts off and they feel a part of our hospital. And I think that's the biggest thing. There is buy-in from them because they're a huge part of our success.
All right. Excellent. All right, guys. Well, again, I want to thank each of you for taking time out of your busy days, dialing in remotely. Virginia, Katie, appreciate you guys tapping in, and then Cole coming here in the studio with us. But these are the folks who are really driving the performance of the organization, clinically, operationally, financially. They're on the ground with our physician partners, with our team members. So I really thought it was a good idea to really hear what's going on in our facilities, both what's going well, what's not going well, et cetera. But overall, we're excited about Legent Health, our affiliated facilities, our affiliated physician partners, and frankly, seeing our leaders continue to grow and thrive and take care of our staff and our patients. So again, thank you three for joining us today on our podcast, Beyond Bones and Muscles.
Thank you.
Thank you for listening to Beyond Bones and Muscles, a Legent Health podcast. We want to hear from you. Subscribe and leave us a rating. Your feedback helps improve our show. For more information about Legent Health, go to legenthealthservices.com.